Hello, welcome back. I love providing these videos and I'm getting some good feedback about how helpful they are. So post in the comments, don't be afraid to engage. And if there's something that you find confusing about rheumatology or want certain questions answered, I am more than willing to entertain suggestions on topics for future videos. So I really appreciate you coming back and joining me again today. And I want to talk about psoriasis and psoriatic arthritis. There's lots of advertising out there, especially during primetime TV, about psoriasis and taking medications to help improve your skin. And then also about psoriatic arthritis and taking medication to help improve that. Well, what is psoriatic arthritis and why is it different than psoriasis? Or if you're a patient with psoriasis and see your dermatologist, why talk about your joint pain? Well, those are really great questions that I want to be able to provide some insight to. Psoriasis is the skin manifestation of an autoimmune condition that causes inflammation or plaque formation, sloughing of the skin on the outside that we can see, right? We can see it, we can feel it, it's super itchy, red, sometimes, another version of a color, sometimes it's more hypopigmented for people. And it can be on our scalp, giving us just like itchy, scratchy scalp. It can be in the belly button and hide there. It can be in your ears. It can be in your private areas. It can be on the palms of your hands and the soles of your feet. It can also manifest as nail changes. You can get cracking and what we call pitting of your nails or discoloration. Some people think it's fungus, but it actually can be psoriasis. And those are all things that we see, right? We often will go to someone to seek help for things that we see on the outside. And deep inside of people with psoriasis can be joint inflammation or tendon inflammation, or just subtle sort of back or neck pain changes. And those are signals that there may be underlying arthritis that we call psoriatic arthritis. And those symptoms often we kind of brush off thinking, oh, I just did something or slept funny and I have a little bit of pain, but it doesn't go away. It doesn't get better. And you can take an anti-inflammatory to make it feel better, and it oftentimes does, but it doesn't really fix the problem. And I really want to encourage you, if you or somebody that you know, a friend or a family member or colleague has visible psoriasis, encourage them to see a rheumatologist. I have a very, very strong belief that every patient with psoriasis should meet a rheumatologist at some point in their life. And the reason that I believe that is because we as rheumatologists have a different perspective to offer than our dermatology colleagues. Don't get me wrong, I have really, really great friends who are dermatologists and I love them. I couldn't do my job the best of my ability without working together with dermatologists. That being said, though, their focus is helping you with your skin, whereas my focus is helping you with the other things that are underneath that. And you really have to have a conversation about the way that you feel to pick up those things. You might see a podiatrist for plantar fasciitis, and you might try treatment for toenail fungus. But if they don't get better and they don't improve with the therapies that you try, then there might be something more to it than that. And that's where we can help identify those very subtle clues that can lead to a more broad diagnosis and open up the doors for more treatment options. And a lot of the things that you may see advertised are very viable options. Those medications work wonderful and have transformed how we treat patients with psoriasis and psoriatic arthritis. But if the warnings and all of the potential side effects, right, the fast talk, small print, fine print, makes you a little bit nervous, that's what the conversation about. Talk to your rheumatologist about psoriatic arthritis. Talk to your dermatologist about psoriatic arthritis. That's where that comes into play, because we can break it down into the tiniest of details of why those big, scary warnings are a broad package label. And yes, there are risks. They are without a doubt possibilities. But if every time we got into our car and we were told over and over and over and over how big of a risk it is to drive, so many people probably wouldn't be driving a car. So we take risks every day. We just have to understand what those risks mean and make sense of that for ourselves, and work as a team along with your healthcare provider and healthcare team to understand when you should stop or hold those medications, when you should keep taking them, when you should change your dose or modify your dose. So all of this is so important. And I just want to encourage you, if you have any doubt whether or not the way your body feels is something more than what your diagnosis is or what you feel you're being treated for, then ask those questions. Ask your healthcare team, could these things be connected or related? Can I see a rheumatologist to discuss this? And feel free to take in, this video or some of the other videos and say, look, this rheumatologist out there is talking about these things and I want to know more. I want to know why she's saying this and why she thinks I need somebody like her. Because you can find a rheumatologist anywhere. And there are multiple new platforms to give access to rheumatologists that may be outside of your city limits. So I hope that these videos are helping at least inform you that there's more out there for you. There's help if you need it and if you seek it out. And I just really love that you keep coming back and liking and sharing and commenting on these videos, and we'll see you next time. Have a great one. Bye-bye.